Is post-coital urination always necessary to prevent bladder issues? Imagine a simple habit that might help keep your urinary system healthy. That habit is urinating after sex, but is it always essential? Not exactly, but it can be a helpful practice, especially for reducing urinary tract infections. When you have sex, bacteria from the genital or anal areas can sometimes enter the urethra, which is the tube that carries urine out of the body. This is more common for women because their urethra is shorter and closer to the anus, making it easier for bacteria to reach the bladder. Urinating after sex can help flush out these bacteria, lowering the chance they cause an infection. That's why many healthcare providers recommend it as a simple, low-risk way to prevent urinary tract infections, especially for women or those who have had recurrent infections. However, scientific studies have not conclusively proven that urinating immediately after sex prevents bladder issues or infections. Some research shows no significant difference in infection rates between those who do and do not urinate after sex. Despite this, because it's a straightforward and harmless habit, many experts still suggest it as a good preventative step. For men, the risk of urinary tract infections related to sex is generally lower because their longer urethra makes it harder for bacteria to reach the bladder. Still, maintaining good hygiene, staying well hydrated, and listening to your body are all important for bladder health. From the perspective of bladder health and bladder cancer prevention, avoiding infections is key. Repeated infections and ongoing inflammation can irritate the bladder and potentially lead to more serious issues over time. While urinating after sex isn't a guaranteed way to prevent infections, it can be part of a broader set of habits that promote urinary health. If you experience frequent bladder infections or other symptoms, it's best to see a healthcare professional for personalized advice. Remember, everyone's body is different, and what works for one person might not be the same for another. Overall, urinating after sex is a simple, practical step that can support bladder health, but it should be combined with good hygiene, hydration, and medical guidance when needed.